Velkommen til Under huden med Asteta Clinic, podcasten hvor vi snakker om estetikk, plastikkirurgi og kosmetiske behandlinger, men også tankene, menneskene og historiene bak. I dag er jeg så heldig å ha med meg en kirurg fra USA, Los Angeles, Dr. Millicent Rovelo, en travel og populær kirurg i hjertet av LA, og som er nå i Norge denne uken for å snakke på det som heter NAM, en internasjonal konferanse, er et samarbeid med den amerikanske foreningen. Og derfor så tar vi denne episoden på engelsk. Hvis dere ønsker så kan dere se episoden på vår YouTube-kanal med norsk tekst. Welcome to you, Dr. Millicent Rovelo.
Thank you.
After the introduction in Norwegian, I think we will be best off doing this episode in English.
Thank you. I appreciate that.
Yeah. And,
my Norwegian is not so good.
No, I just had this short introduction of you as an American plastic surgeon coming from the heart of LA, the area called Beverly Hills.
Yes.
Which in my opinion is really where the plastic surgery comes from in a way, at least the aesthetic part.
Yes, it's sort of the mecca of plastic surgery. I would say in the world, in a lot of places, there are many cities that do plastic surgery very well, but for whatever reason, Beverly Hills is definitely sort of known for being a hub of plastic surgery.
So it's really nice to have you come here all the way to Oslo and Norway. And have you had some time to walk around the streets of Oslo?
I have, yes. One of the things I like to do when I visit a new city is really just walk the city. We don't get to walk much in LA. LA is very car-based. But I feel like if I can just walk around and go to some local areas and restaurants and stores, I can kind of get the feel and the energy of a city much better.
Yeah.
So I did. I spent some time walking around the city today, going to some vintage stores, some local cafes, and it's been great. Oslo's been really wonderful.
Sounds nice.
It was nice.
Is there something when you walk here and look at the Norwegians?
Yes.
Is there something that you can see that's different from the population of LA?
Ooh, that's a tricky one. You know what? I would say it's kind of hard to tell. And this is one thing I did notice, and this is such an obvious statement. But it's so much colder here than Los Angeles. So people are just bundled up more. You don't get to see as much of the people, I feel like, because they're wearing their hoods and their hats and their scarves. So I feel like, if anything, the face is more noticeable here than perhaps the rest of the body is, whereas in Los Angeles it's kind of the opposite.
Yeah. Well, that's a really interesting observation.
Yeah, I feel like, and I don't know, you'll tell me, but I feel like plastic surgery here might be more focused on the face than the body.
Yeah, maybe.
But that was just my quick observation.
Yeah. And I do know, and I look at the statistics that comes from the Aesthetic Society in the US, because you're really good at having good numbers, which we are trying to develop here in Norway as well, which we started just recently. But I think that the number of procedures within the different areas, like facelift, breast, liposuction, eyelids, etc., is kind of pretty much the same, I would say.
Oh, okay.
Yeah.
All right. As it is here.
Yeah.
Okay.
I think it's quite similar. And I also think when I've done some research of you, and of course I'm a really big fan of your podcast, the Beverly Hills Plastic Surgery Podcast.
Yes.
I recommend it to everyone that I know. And I also read a little bit more about you on the internet before this meeting, and I do see that you have this nice holistic approach to your patients, which I really appreciate. I think it's super important that of course, through your podcast, you really show that you're a pioneer and know the field and research and everything about plastic surgery, but also knows how to treat and see the patients.
Yes.
And yeah,
I think that's really important because, you know, if you've ever had a chance to be a plastic surgery patient yourself, even as a plastic surgeon, it's scary. Like, even as someone who knows so much about surgery, anytime that you put yourself in the hands of someone else, it is a really trusting thing to do, and it's really scary. And so if you can kind of keep that in mind when you're treating your patients, it might be super routine for you. Like, you're doing 2 or 3 cases in a day, and you've done 2 or 3 of them yesterday. Like, it's very routine for us. But for the patients, it's a big deal. And you have to take into account the stress, the anxiety they're feeling, and really be able to treat and manage all of that, all of their emotions as well, as opposed to just, you know, the surgery and the cutting
technical stuff
and the technical side of it.
Yeah, I think it's really important. It's just like you say. It's a normal day at work for us,
right?
And it's a huge day for the patient.
And it's, I forget that. And it's something that's really important to remember for like every surgery. This is a huge day and a big deal for this person.
Yeah. And having that said, it's also of course really important that we know the technical stuff and we know all the research behind plastic surgery. And of course, plastic surgery it's a huge field, and we have to study, we have to read the articles, and attend congresses.
Yes.
And now with the Norwegian American Aesthetic meeting here in Oslo, it's a good kind of arena to meet surgeons from different areas. There are several surgeons from the U.S. coming over, some other countries, and also attendees from a lot of countries coming here to Oslo this week.
That's wonderful. I think, as you mentioned, it's a combined meeting between the American Aesthetic Society and the Norwegian Aesthetic Society. And so being able to combine those two forces is really powerful. And I am super excited to see that the different countries that are represented here, in addition to Norway.
Absolutely. And I think it's nice to, you know, every year to try to find some meeting to attend, and just to make sure that you are at, updated on the newest technologies and whatever research is out there.
I mean, the field moves so fast. And so from one year to the next, things are invented, procedures are changed, new protocols are developed. And if you're not staying in that world, it's easy to fall behind really quickly. So I'm trying to limit some of the conferences I go to because it can be a lot, but I definitely try and get to at least one or two a year, and that it's great. I mean, it really keeps me on my toes. And then I don't know about you, but whenever I leave these conferences, I'm always like, man, I'm the worst plastic surgeon ever. Everyone else is so good. Like you hear all these great presentations, and you're like, wow, that's amazing. So it inspires you to be better and to do better.
And to do the best that we can for our patients, right?
Yes.
So I'm really looking forward to your talks as well in the next couple of days. But talking about that technology and development in the field of plastic surgery, do you see any specific trends now in LA or Beverly Hills that might not have come here to Oslo, or is it?
Yeah, that's a good question. I feel like no matter what year it is or what decade it is, people are always saying that breast implant sizes are changing. And I actually don't know if that's true, because from one year to the next, we're saying, oh, we're getting smaller, or oh, we're getting bigger. And I think in Los Angeles, the trend is to stay more or less bigger. But I did go to a conference a few weeks ago that was national based, and so it was surgeons from all over the country, not just Los Angeles. And I will say that I think in America in general, the trend in breast implants is to go a little bit smaller. I just think in Los Angeles, they haven't quite gotten that memo yet.
Okay. No, but I think with talking about breast implants, I think also, at least I see here in my practice, I do see a lot of women that have old breast implants. And with that, there is a change with, you know, you have to, at some point you need to change these devices. And I think a lot of time it's kind of, with surgery and the technique and results, it's easier to kind of go a little bit bigger with the implant. But then you have to take into account that some of these patients, they don't want that anymore. They want to go down in size, and then you might have to consider a breast lift or some combined procedure with that.
Yeah, absolutely. We see, so I would say, you know, when you first have your breast implants placed, it's easy, right? That you're in your 20s and you put these breast implants in and you're recovering, you're back to work and doing your thing in a week. And then, you know, 15, 10, 20 years go by and it's time to update these implants because they're not designed to last forever. And all of a sudden, it's a much bigger surgery than just putting them in like they did the first time. And so usually if you've had kids or there's been changes in weight, you do need some kind of lift. You may have some complications related to the implants, like capsular contracture or rupture that has to be addressed. But I find actually, and you kind of reference this, the hardest thing to do in revision breast implants is go smaller. It is so much easier to go bigger or even just stay right about the same size. But going smaller with breast implants is a much bigger surgery than I think people really understand, because you have to address the internal pocket where the implant sits. You have to do something about the skin, because the skin is larger and sitting around a larger implant, so you have to reduce the skin and do a lift of some kind. And it's just trying to reshape that breast into a smaller size is actually kind of tricky.
Yeah.
Yeah.
And I think it's really important that these patients, they understand kind of the choices that they need to take. Of course, with us guiding them and trying to say, like, if you go bigger, it's an easy job. If you go smaller, you have to do this and that, and it might be more scarring and a little bit more complicated with regards to the results and stuff like that.
Right. I guess my question to you would be, what would you say, there's no average patient necessarily, but what is the average patient in Norway looking for when it comes to breast implants?
Like primary augmentations?
Primary augmentations or revision. Like, what's the look that they are going for?
I think they're all like, it's a little bit different, because I've noticed that patients, they come into my office, they sit down and they say, I just want natural breasts. But when we start talking, or even if they take up their phone and some social media and they show the photos of breasts they like,
right.
In my opinion, not that
natural. Like, natural breasts don't look like that.
But I think, like, when you talk to the implant distributors, I think the average in Norway is about like 300, 325, something like that. So it's not that big.
It's not that big,
no.
Especially depending on how large or tall the patients are. I could see how that would give you a natural-ish breast look.
Yeah.
You're going to definitely have more superior pole, upper pole fullness because it's an implant, but it's not going to be over the top, ostentatious.
Yeah, but you like talking about these breast implants, and like some women with breast implants that are really old. I mean, the patients kind of mature as well.
Right.
Do you see that in your practice, that you have kind of older patients than before, or like is there a change with that, or?
I would actually say that I've noticed more older patients coming in for their first plastic surgery.
Okay.
Like, we definitely have the patients that are older and need revisions and have things exchanged and swapped out. But I would say that there's actually more patients that are having their first surgery, their first plastic surgery, older than they used to be. Obviously, people who are getting facelifts, they're always going to be a little bit older. But even tummy tucks and breast augmentations, it's not just for the 20 and 30-year-old women. I'm having women coming in their 50s and 60s having their first plastic surgery, and it's like a body surgery.
Yeah, and they still feel young despite like a higher age, and they feel like vital and full of energy.
Yeah.
And they want also the body to follow this.
They want it to follow.
Yeah.
And like, hey, I still have another couple decades.
Yeah, it's not over yet.
It's not over, so might as well get myself tuned up here.
Yeah.
Yeah.
But I think as I've understood, I mean, for instance, in US and many other countries except Norway, I know that patients are really curious about before and afters. And I also heard you talk about it in your own podcast, how important that is to see kind of the aesthetic eye of your surgeon and the results and etc. In Norway, we're not allowed to publish before and afters. And in my opinion, I think there are also, of course, some disadvantages with, of course, maybe some more difficulties for the patients to choose the right surgeon for them. But at the same time, you kind of avoid other problems that we see, you know, like some surgeons, they do the Photoshop or they cheat with lighting, the angles and makeup before and afters. So do you have any thoughts about that, or how does that work for you in Beverly Hills?
I have a lot of thoughts about that because I find it very interesting. And I guess my first question would be, how do you advertise? So as you referenced on our podcast, we talk a lot about the importance of befores and afters, because what you see on your before and afters theoretically is what you should more or less be getting from that individual surgeon. And I think a lot of people think that any plastic surgeon is the same. You're all more or less the same. You all do the same thing. But every surgeon has a different eye, and a different look that they like and that they achieve. And so I think it's so important to know sort of what you're getting, and the befores and afters are really helpful for that. And I feel like that's how a lot of our patients in the United States find their surgeon is, I like those results, or they're really active on Instagram or social media and I can see what they do. And so I would ask you, how do you market? What brings patients into your office if it's not the befores and after photos?
Well, I think they do a lot of research. I mean, mainly the patients that comes, at least to me, they are referred by some that knows me or have been a patient to me already, which is of course
that's the best, by the way.
Which is really nice.
That's the best.
And but of course, also in Norway, it's very common that the consultation fee is very low, and it used to a few years ago it was free, actually. Because of course I don't think that our service should be free, absolutely not. Right. I really do think that we give good advice. I put 45 minutes to all my patients for a consultation, and I think that even if they don't choose me as their surgeon, I think they leave my office with some valuable new information, so it should be
that's worth something.
Yeah. And also it's kind of a signal that it's a little bit more serious than a free kind of consultation where you kind of trick people to come in and you're going to like talk them over and have surgery in a way. So it just really doesn't feel good to do the free consultations. But I do, at least with the Norwegian system, I think it's kind of nice that it doesn't cost too much as well, because it kind of leaves the patients open to do a lot of consultations.
Got it.
So I do see patients that have done like 2, 3, or 4 consultations before they choose their clinic or surgeon. So that's, I don't know, it's that common in your practice, or?
So we do charge consultation fees, and depending on where you're at and your level of experience, they can be very expensive or they can be on the more moderate side. But ours is different because they've already seen our results. So theoretically, they shouldn't be going and seeing 4 or 5 people. If they want to, they can, to see how they get along with the surgeon. But especially with all the marketing that we can do and with our podcast, there's so many ways patients can get to know us and our results before they even come in the door. Is the consultation system, is that mandated by Norway, the fees, or is that something each individual plastic surgeon can decide how much they want to charge?
The Aesthetic Society, or they have put a minimum fee.
Got a minimum fee. So you can charge more if you want to,
absolutely.
But there is a minminimum fee, and before that it was free. So your patients come, word of mouth, they hear about you, they meet you, they see your in-person result, befores and afters. Can you put befores and afters on your website?
No, but we can show before and afters in office.
In the office.
Yeah.
And what is the reason for that from
I think
the Norway
just the government, they really don't want to put out too much information and kind of make a pressure on young individuals or so
I think that's that has been talked about in America, whether or not we should be advertising plastic surgery, etc., to minors and people under the age of 18, and I get that.
Of course, sense. It's important that I mean we don't want to make at least my philosophy is that the best choice is always not to do surgery, but at the same time we do see every day how big impact it can have with surgery on patients' lives. So it's a little bit difficult because at one time you think that's, don't do surgery, but at the same time you do know how much it can be of value for the individual. So I think it's always a little bit difficult, but it's most importantly, I think it's good or important that these patients, they have good information and then they can take a good choice for them.
Right. Yeah, that's the most important.
Yeah,
I agree.
But so with that, I think at least in my head, I have this idea, or you can tell me wrong, but I think in Norway, the patients are a little bit more careful. They are maybe more looking for the natural results, and as LA or Beverly Hills, it's a little bit more glamour, or I don't know. I just have a feeling that patients come out of your office maybe being more proud of their cast on the nose, or I don't know. Here they want to hide in the dark.
Yeah, no, you're not wrong. There's a certain, and part of this is social media generated. People want people to know that they've had plastic surgery for many reasons. Some just feel the need to share their stories and what they're going through. Others, there's sort of a status symbol to it. And so I think people are a lot less hesitant to talk about having plastic surgery and sharing their stories. And it is sort of a mark of honor or whatever to come out of your doctor's office with your nose splint on or the bandages around your face. I mean, I'm in the middle of Beverly Hills and you just see these patients walking around down the street. You know, no shame. They're not hiding what they've done. And then those same patients will go on Instagram or TikTok and detail their entire surgical story from their consultation to their surgery to their before and after. So they share with the whole world. They share the whole world. There's no mystery to what they had done. And so I think there's a little bit less, I don't know, secrecy around it. Yeah. It's a little more common, I think.
Yeah. I do see a change in that here as well, like especially for like upper blepharoplasty. I think it's a lot more acceptable.
Okay.
And sometimes I see it's kind of almost like it spreads in the office. You know, like if some of the worker comes here, do the eyelid. And like over the next months, you know that there will be more from them.
You see all of them coming, because once one person has it done.
And it's kind of positive in a way, because I mean these patients are really happy about it and can discuss the pros and cons together.
Yeah, I can see that, how especially upper eyelid surgery, it's not a big change, but people need it. Like when you really need to have that extra skin, there's almost a medical thing that you can say is going on as well. So it's not, I can see how it might not have such the stigma to it than other plastic surgery procedures.
It's more acceptable in a way.
It's more acceptable.
Yeah. How about some women, they come into my office and still they feel shame. And I don't know if you see those kind of patients, but I mean, I have patients that say they don't even undress in front of their partner or and are really ashamed of kind of how their body looks and feels. And is it this? Do you see these kind of patients despite like the open society that you live in?
No, we definitely do.
Yeah.
I have a big weight loss population, and so these are patients that have lost a lot of weight from various surgeries or medications. And so these are patients that have never been comfortable in their bodies. When they were larger and overweight, they weren't comfortable getting undressed. And then they lost the weight, and then they have all of this extra skin. So I've had those patients that said, you know, my husband or my partner has not seen me naked in years. And then we do the surgery, and they're beyond thrilled, and everybody's seeing them naked. So I think that there is always going to be people and patients who are unhappy or unsatisfied or self-conscious about how they look. And I don't know that that's necessarily a Norwegian or an American thing.
Sounds quite similar.
It's very similar.
It's like private kind of personal issues.
Right. The difference is in America, they will tell their whole plastic surgery story.
All right. I think that kind of rounds up the talk. We have talked a little bit about what's similar, what's different, the field of plastic surgery, and also the patient population. So I really want to say a big thank you for coming here. I prepared a small gift for you.
Oh.
This is something called Face Formula. 2 products. It's a Norwegian cosmeceutical brand, and I really, really like it myself, and I hope you can enjoy this also.
I look forward to using it.
Thank you so much.
Thank you.
Tusen takk for at dere lyttet til vår podcast Under huden. Følg oss gjerne på Asteta Clinic, og send gjerne spørsmål eller kommentarer. Dere kan også nå oss via vår e-post, post@asteta.no, så høres vi i neste episode.
Tusen takk.
Yeah.